We've got a problem, a big one. COVID-19 is coming back with a vengeance. Just 1 month ago, most all of us thought we were in the clear. The virus was on its way to fading into the background, but it didn't. The virus is spreading like wildfire again because so many of our friends, neighbors, and relatives are not getting vaccinated. We're here to bring you the facts, and the fact is we can beat this pandemic, but it's going to take a lot more work.
It's literally about life and death. It's about life and death.
If you are not vaccinated, you are at great risk.
Every federal government employee will be asked to attest to their vaccination status.
Unvaccinated employees will be tested at least once a week and required to wear a mask.
New pandemic rules at the local and national level. Governor Cooper addressing our state, President Biden addressing our country. Thousands of workers will have to get the COVID-19 vaccine or get tested weekly. Tonight we break down the details and get expert insight about the new wave of cases that brought us here. Now let's start in our state. Governor Cooper gave orders to all workers in state cabinet agencies. WFMY News 2's Alma McCarty dug into the details and what state leaders say about it.
Well, both the governor and Dr. Mandy Cohen said today unvaccinated people are driving the resurgence of COVID-19, and the Delta variant is a big cause for concern.
This virus is now much more contagious and spreading fast, and it'll find you if you're unvaccinated.
The original COVID spread from one person to an average of 2 to 3 people. Now, the Delta variant spreads from one person to an average of 6 people.
Our state leaders say it's a pandemic of the unvaccinated, a moment that requires action with a new executive order. First, cabinet agency workers will be required to show proof of vaccination or test weekly for COVID-19. This includes the Departments of Health and Human Services, Public Safety, Transportation, and 7 others. Face coverings will also be required in those offices for anyone unvaccinated. The order also encourages agencies, school districts, and private businesses to mirror these actions or even take them a step further and require vaccinations.
So what's the bottom line here? It's simple. Get a vaccine now.
In addition, the order follows the CDC's lead, strongly recommending masks for students and teachers in K through 12, and recommending people in counties of high transmission wear masks indoors, regardless of vaccination status. There are religious and medical exceptions, but those cabinet agency employees would still need to test weekly. These policies go into effect September 1st.
Alma, thank you. We mentioned this new rule applies to workers in state cabinet agencies. Take a look. There are 10 of them. It includes Department of Transportation, Public Safety, Health, Revenue, Commerce, and more. We wanted to know whether our local governments plan to do the same. Winston-Salem Mayor Alan Joines says he's considering it.
Our city attorney is taking a hard look at that and what might be our authorization in those regards. I know some other mayors I've talked with are considering it, but are maybe thinking about holding off until the FDA gets more the formal approval for the vaccines rather than the emergency orders.
We also asked Guilford County Commission Chair Skip Alston. He says he supports it, but still has to talk to the other commissioners. Mayor Ian Baltutis said the city of Burlington hasn't discussed it yet. A rep from the city of Greensboro told me today they aren't planning on requiring them right now. Now, all of this is because of this, an alarming spike in our cases. The state says that it learned of more than 3,200 new cases in the past 24 hours. Now, we haven't seen a number this high since late February. It's easy to see the steep incline of new cases over the past couple of weeks. Look at all the low numbers we were celebrating just a few weeks ago. It's hard to believe we've gone in the wrong direction so dramatically. The number of North Carolinians in the hospital with the virus has also gone up drastically in the past couple of weeks. The latest number, 1,141. It's 50 more than yesterday and double the number we saw just 12 days ago. Consider this, we marked a low of 373 patients on July 3rd. That was less than a month ago. Now here's all of that data put into map form. These are the rates of virus spread in our state, county by county. The highest rates are in red. WFMY News 2's Grace Holland has a closer look at the situation in Triad counties and what local experts say about it.
We do have a few counties in our area with those highest rates of community spread, like Davidson and Stokes counties. But much of the Triad is in the orange, which means substantial spread, which is not quite as high. Wake Forest Baptist Health infectious disease expert Dr. Christopher Oles says most of that spread is among unvaccinated people who are also getting the sickest.
The number of vaccinated people getting admitted to our hospitals is so low, it's hard to measure. Deaths is basically none. I haven't seen any deaths in our area in a vaccinated person.
Health experts say people living in areas with high and substantial viral spread, like here in the Triad, might need to mask back up again indoors, even if they're vaccinated, because of the possibility of breakthrough infections, which are still not really understood.
It looks like people who have symptomatic breakthrough infections can transmit it to an unvaccinated person. What's a little bit up in the air is that can an asymptomatic person with a positive test transmit it to an unvaccinated person.
Cone Health Director of Pharmacy, Dr. Andre Harvin, says vaccines and masks are the best tools to slow the spread.
Right now, what we're missing is that commitment from everybody in the community to come in, get vaccinated, and to continue wearing those masks if they're put in a situation where they don't feel comfortable or normal precautions aren't able to be met.
Dr. Oles says we'll likely see less red and orange in a few months when this wave passes. But health officials stress we can change this picture now with vaccines and masks while saving lives in the process.
Grace, thank you. Hospitals across the state will require employees to get vaccinated. In Greensboro, dozens of Cone Health workers pushed back against the mandate today, protesting outside the hospital. The hospital says every employee must be fully vaccinated by the fall. We met workers who told us they're worried about losing their jobs.
At this moment, it is not FDA approved, and I think a lot of us, we just kind of want to wait and see. You know, what if they make changes to it after we got it?
We don't feel safe about it for ourselves, and we feel like we have the right to choose.
Cone Health sent a statement today responding to the protest. It reads in part, "We value our team members' rights to voice their concerns. At the same time, we remain steadfast in our decision to require the COVID-19 vaccine." 3 Triad hospital systems are requiring vaccines. Cone Health employees must be fully vaccinated by October 8th. Wake Forest Baptist Health workers have until the end of October. Devant Health's deadline is sooner, September 15th. The hospitals say employees who don't get vaccinated could lose their jobs, but there are medical and religious exemptions. Now, Triad school districts pass their own pandemic requirements. Guilford and Winston-Salem Forsyth County students and staff must wear masks in the classroom. Some parents say they're against the safety measures. It's led to increased interest in private schools. New Garden Friends School and Greensboro Day told us applications keep coming in. The principal at Guilford Prep, a charter school, said they have 525 students enrolled this year, their highest number ever.
We recognize that the public school system does an awesome job taking care of kids as well. But there's a choice environment that we live in, right, where parents tend to look for good fits for their student.
Private and independent schools do have more flexibility, but most of the schools we spoke with say they will still require masks in the classroom. Now over to the new protocols at the federal level. Today, President Biden announced new requirements and incentives to get more people vaccinated nationwide. He said this is an issue of life and death.
If in fact you're unvaccinated, you present a problem to yourself, to your family, and to those with whom you work.
To reverse the trend, the president touted new incentives, like urging states to offer $100 to every newly vaccinated American.
I know the paying people to get vaccinated might sound unfair to folks who've gotten vaccinated already. But here's the deal. If incentives help us beat this virus, I believe we should use them.
He also announced that all civilian federal employees, plus contractors, will have to get vaccinated or get tested for COVID-19 weekly or twice a week. They'll be required to wear a mask, social distance, and might have official travel restricted. President Biden also directed the Defense Department to look into requiring vaccines for all service members.
The vaccine was developed and authorized under a Republican administration, and it's been distributed and administered under a Democratic administration. Look, this is not about red states and blue states.
The new requirements for federal workers go into effect immediately, but agencies will have time to establish vaccination and testing programs. We wanted to know what you thought about this federal mandate. Many of you commented on our Facebook page. Samantha writes, "I don't think it's fair at all." Ricky says, "People are tired of guilt trips and inconsistent information." Remember, our goal is to get the vaccine rate between 70 and 75%. We've got a ways to go. Right now, 55% of the eligible population is fully vaccinated in our state, a number that represents millions who are already doing their part. We have another 20 or so percent to go to reach our goals. Let's hope we can get there.
You know, today was the hottest day so far this year, and it's not likely to be passed anytime soon. Going into tomorrow, we'll have another temperature pretty similar to this, in the 90s one more time as we welcome in our Friday. Show you how hot it was today and how hot it still is. It's 11 o'clock now, of course. 84 currently in Winston-Salem, 81 in Greensboro, and 82 in Burlington. That's not something you often see, is it? You look off to the north tonight. We're here in the Triad. In fact, the north and west, you might be actually finding some lightning strikes. In the next couple of hours, they'll be approaching the North Carolina mountains, missing us a little bit to the west, but something to keep an eye on all the same. For tomorrow, starting out sunny in the morning, warming up very quickly. We'll be around that 90 mark by lunchtime, and if you blinked, you missed it. Just a couple blips on the radar for the afternoon. There's a low storm chance. But the thing about tomorrow is we're actually going to have a little bit of a front sliding by right around this time frame. Sure, that could pop a storm, but what it'll also do is bring in a little bit more comfort as we welcome in the weekend. I'm expecting things to change. Humidity will change, temperatures will change, and that gives us a little bit of relief from all this. For tomorrow, we're still at 92 degrees, feeling a little hotter than that. You can hold me to that for Friday. Now, coming up, we'll detail Saturday versus Sunday and why I think one day is way better to get outside.
Okay, let's take a breath and let's take a quick break from coronavirus. We have a story we think that you will like. A man is doing 50 push-ups in 50 states in just 50 days, and it's all for a good cause. Don't miss it. Next.